Hello, I had a few questions from some recent CPR classes that I thought were just kind of good general questions. Doesn't fit into one particular video in general, but just some random Q&A things, primarily about CPR. One of the big ones I get asked is why 30 compressions and 2 breaths? We know that for the adult victim, oftentimes they have a body that's kind of full of oxygen, and compression-only CPR is good if you're unwilling to do the mouth-to-mouth, like you don't have a barrier device, and I fully support that decision. If you want to do chest compression only, it's definitely better than doing nothing. However, if you have a barrier device or some sort of airway device and you can do 30 and 2, American Heart says that is better. But why 30 and 2? Well, the numbers have changed considerably over the years. We've had different ratios like 5 to 1, 10 to 2. I think there was a 4 to 1 in there for a little bit. And we're at 30 to 2 for adult CPR and infant and child CPR if it's one rescuer. Now, if you're a healthcare provider and there are 2 rescuers there for infants and children, remember we go to 15 and 2. Well, the research that we have shows that it takes probably about 5 to 6 compressions to build up enough pressure to begin to circulate blood throughout the body. And then the longer we can keep the compressions going, the better we can keep the pressure going and keep moving that blood. However, at some point, we do need to stop and give some oxygen. And right now, we think 30 and 2 is about the best compromise that we have. Realize when you give those 2 breaths, the amount of pressure in the bloodstream goes down significantly. And then when we resume CPR, it's going to take 5 to 10 compressions to build it back up again. So we think 30 and 2 is about the best. There was some studies done thinking like 50 to 2, and there was some talk about maybe changing it to that. But 30 to 2 is where we're at right now. That's what the research shows is the best compromise. Now, why 15 and 2 for infants and children? And I kind of a little frustrated because you have to remember 2 sets of numbers if you're a healthcare provider. We switched to 15 and 2 because we know that infants and children need additional oxygen. Typically, the infant or child will go into cardiac arrest because they run out of oxygen and not because of a heart problem like ventricular fibrillation. So even though we use an AED with an infant and child, we are an automated external defibrillator, if you have one available, it's probably not as likely to shock a child or infant as it is an adult victim of cardiac arrest. Typically, the child or infant needs more oxygen, which is why we want to provide 15 compressions and 2 breaths if it is 2 healthcare providers. If you're by yourself or if you're a lay rescuer, not a healthcare provider, just remember 30 and 2, 30 compressions and 2 breaths. Next question kind of goes along with what we just talked about with the 15 and 2 versus 30 and 2. And the question is why is it important to start CPR in an infant with no pulse or breathing before calling emergency services, then call services after 2 minutes of compressions? So in your CPR classes, you'll learn that there is a call first for adult victims, which means if we find someone unresponsive, not breathing on a pulse, we're supposed to call for emergency services or call for backup and send someone to call 911 and get the AED. If you are by yourself, you're supposed to go call 911 and then come back or pull out your cell phone, which is better, put it on speakerphone, call 911, and then follow the directions of the dispatcher. However, for infants and children, they recommend that if you're totally by yourself and you don't have a cell phone with you, maybe you left it in the house or you left it somewhere else, you don't have a way to call 911 and there's no one around, for infants and children, we're supposed to do 2 minutes of CPR first. And that goes back to the need for oxygen for the infant and child. Again, typically the adult victim, when they go into cardiac arrest, it is oftentimes due to the heart going to an abnormal rhythm called ventricular fibrillation, and the AED is needed to fix that. CPR buys us time until the AED gets there. However, with infants and children, oftentimes they go into cardiac arrest because of lack of oxygen. So if we do some CPR first, maybe get some oxygen in, circulate it around for a couple of minutes, and then go leave the patient and call 911 and come back. Now, if it's a small child or an infant, obviously you can pick them up and move to a phone, and that might be a good option. But if you can't move them and you have to do CPR, can't get 911 right away, call 911, do CPR for 2 minutes, then go call 911. Flipping to the other side of things, geriatric CPR. So this question is specifically, are there different methods to perform CPR on elderly patients? And there isn't. Now we know that when we do chest compressions on patients, we oftentimes feel some popping and snapping. Now only at about 29 to 30% from what I could find online, studies say about 29 to 30% of the time are we actually breaking a rib. The rest of the time is typically breaking the cartilage or popping the cartilage like you would pop a knuckle, crack a knuckle. Elderly patients, obviously the bones are a little frailer, so you're probably more likely to fracture the ribs, but there's nothing that we do differently. We still want to compress at a rate of 100 to 120 compressions a minute, making sure that we press between 2 and 2.5 inches and allowing full recoil of the chest when we do CPR. The same is what we would do for any other adult victim. All right, another one for infants, how to keep the correct rate of compressions for infants. Whether it's adult, child, or infant, we feel that the compression rate, the best that we have, best the research, the data is showing us, is that between 100 and 120 compressions is optimal. So at least 100, probably less than 120 to allow time for the heart to fully refill with blood. Most people will hum a song, think a song in their head, and of course American Heart likes the one Staying Alive. That's a good beat. If you're thinking babies and infants, Baby Shark. I'm not going to sing it, don't worry. But that's another one that will give you that rate between 100 and 100 and 120 compressions. There are other songs that are just tongue-tied, other songs that will do it, but try to keep that 100 to 120 compressions a minute. The amount of force to be used on real-life patients, and I get asked this one a lot in CPR classes, if the mannequin is similar to what it's like in real life. And I'm going to say the mannequins are probably a little bit easier, but it all depends on the size of the patient. So there isn't an exact number for every patient. However, from what I saw online from some research, the average patient, we want to compress with about 100 to 125 pounds of pressure. Now in real life, what are we looking at? We're looking at trying to get a compression that goes 2 to 2.5 inches. Now I know that's a really small range between 2 and 2.5 inches, and American Heart recognizes that and would much rather have us press too hard than not hard enough. Most people that do CPR don't seem to press hard enough when they do compressions. And some of that may go back to feeling those things pop and snap, and it's kind of an uncomfortable feeling. They don't want to hurt the person, I get that, but the person isn't feeling anything if you're doing CPR. So make sure you're pressing hard enough, at least 2 inches. This next one was an interesting one, and I could not find a specific answer online when I was doing a Google Scholar search and PubMed search. But how often do people's lungs burst, is what the question said, from doing mouth to mouth or even any sort of rescue breathing? Now for the average adult, they take in about 500 milliliters of air. So if you can think of like a 20-ounce soda bottle, that's 600 milliliters. Some of the half-liter water bottles, that's about how much you breathe in a typical breath. Now bigger people breathe a little bit more, smaller people a little bit less. So they say the average is about 5 to 7 milliliters for every kilogram of air, kilogram of body weight. 5 to 7 milliliters of air for every kilogram of body weight. So somewhere around 5 to 600 milliliters in an average breath. So if we go and give our rescue breath, we're probably not going to pop the average adult. Now for a small child or an infant, that is a possibility. So when you're breathing for an infant, they recommend about what you can hold in your cheeks, that sort of puff of air. But you know when you've given enough breath because you'll see the chest start to go up and down a little bit. And when you see chest rise, you know you're giving the right amount of breath. You don't need to get much more than just seeing a little bit of chest rise. You start giving too big of a breath and you can cause some problems, both with the lungs, especially in infants and children, but also with the chest compressions themselves. You can slow down the amount of blood returning to the heart if you give too big of a breath. So just enough to see chest rise. So those are some of the questions that I've had on CPR. I have other questions here that I'm going to answer, but they don't really fit into a CPR type category, or really any category. Each one was different from this class. So I'm going to answer those over the next few days. If you have any questions about CPR, I've been teaching it for a long time. I'm not the American Heart Association. I'll do my best to answer it. I'll do my best to find what American Heart says is the right answer and provide that for you. If you have any questions, just leave them in the comments below. So hope this was interesting. Thank you very much for listening.